Hi, my name is
Go for it.
Hi, my name is Teresa Mills, and I've been asked by Dr. Jeff to give my testimony about an injury that I had 2 years ago. I am a 59-year-old mother of two. I'm an emergency room nurse for 40 years, and so there's a lot I know about the human body, and so I'm going to share with you my personal experience. About 2 years ago, I fell off of a ladder and landed on the left side of my body, hitting my hip, shoulder, and left side of my neck. At the time, I felt that everything was okay and got up and continued to finish what I was doing on the ladder. And about a month after my injury, I started to experience left-sided neck pain. I have gone from the last 2 years of when I hurt myself on and off to a chiropractor and massage therapist to get temporary relief from that pain. The pain then started to increase and start to show up in my left scapula area, which is my shoulder blade. And the pain was probably like a 7 of 10 throughout the day sometimes. I was always trying to self-massage, self-crack my neck and manipulate my neck. Working in the emergency room, I required to do a lot of lifting and straining, and so it became a real problem. Also, the computer use would aggravate my neck. Hard for me to sleep at night. That's been going on for 2 years, and then about a year ago, I started having some swallowing difficulties, and felt like there was a lump in my throat, like I couldn't swallow correctly. Peanuts started to get caught and popcorn started to get caught, and I went to an ENT specialist and they told me everything was fine, and I just knew that something wasn't right and that it had something to do with my neck, but I couldn't figure it out. I kind of just blew it off, and then the last 6 months ago I started having chest pain every time I became aerobic. I had 6 episodes of that. Every time I was aerobic I would have chest pain, jaw tightness, shortness of breath, until I got my heart rate back down. So then I went to a cardiologist, like all of us would do, and had cardiac catheterization, and everything was normal. Miraculously, all those symptoms went away with the chest pain due to prayer, God, but then I started getting cardiac arrhythmias, this irregular heartbeat. Then it became so irregular and started to become very fast. I would wake up in the middle of the night, heart rate 130, 140, my stomach was I was more nauseated, more bloated, and I just felt like the tightness in my throat, the irregular heartbeat, the stomach issues, the increase in insomnia were all related to one specific thing. And when I made an appointment for a neurologist, I just felt like in prayer, I was told not to go there, and had a happenstance appointment with Juanita, and she's like, I think we can help you. And I said, well, I think this is the vagus nerve, because I did some research and felt like everything was pointing towards that, and I just knew I needed to find somebody that would listen to what I had to say. And so I made an appointment with Dr. Jeff, and here we are. So he adjusted me, and the first time he adjusted me, he then put me on a cooling down program for my stomach. But really, immediately after the first adjustment, I had been cardiac arrhythmia free. I had no irregular heartbeat for the last, I guess I've been here probably 6 weeks now, and my swallowing has improved. So those are my praise reports as of now.
That's awesome. It's so interesting because like you knew that it was vagus nerve related.
Yes, I felt like it was. When I started doing the research and tying all my symptoms together, they all pointed back to the vagus nerve, that it was being dampened.
Mm-hmm.
Hence, my sympathetic nervous system wasn't being balanced.
Way to go. That is brilliant. When there's, in the spine, we found a severe misalignment at the first cervical vertebrae underneath the base of the skull. And there was such a significant misalignment. The lower part of the brain comes right down into the first bone. So if you have a left or right lateral shift or a rotation or a tilt, you can guaranteed know that is going to put pressure on the vagus nerve. And over here, I want to show you on the anatomy map. Out of the brainstem area, right up top here, you follow this nerve. This nerve goes right to the heart. This is the vagus nerve. It also goes to the lungs. And interestingly enough, it leads all the way down into the stomach. So, yeah, so her gut intuition, once again, if you listen to the patient close enough, they will give you the keys to the kingdom, and you can figure out, reverse engineer where the root cause of the problem. In this issue with the heart, irregular heartbeats, right?
Right.
Did you say it was tachycardia?
I started getting tachycardia on top of PVCs, or irregular heartbeat.
Okay. So we took a digital x-ray, we found the misalignment. We went right after that first because we want to bring the body out of fight or flight. And that is one of the biggest things we do with the Wellness Way approach, is we begin to bring the system out of fight or flight. And that was enough. Removing the pressure at the brainstem allowed the heart not to be stressed, and it went back into normal rate of rhythm. Mm-hmm. And so it's basic anatomy, physiology, but we always have to check when a person comes in with whatever. We want to look at the spine, because that fall off the ladder was a very detrimental one to the organs later on. And even though the pain's gone away, but Teresa still had the nerve pain coming out of the nerves going into the scapula behind the shoulder. Mm-hmm. Even though she had that pain, she had the pressure, the compressive pressure to the organs is what does the silent, deadly damage. If you're not checked properly after a fall or a trauma, this way, a proper nervous system check. Just imagine if we didn't listen to her, thinking, and she was like, I believe it's vagus stress, that heart would have still had that stress, and that would have done further damage to the nerve pathway, the vagus nerve, stressing the heart function. And of course, we need the heart function to be precise on the human machine. And so, because that's a primary organ, obviously, just think what 10 years of vagus brain stem choking nerve pressure would do to that heart. Mm-hmm. Definitely bad. So I think this is just amazing. We've just started with Teresa, so there's going to be a lot more victories to come, but we wanted to explain that in just a couple weeks, we waited a couple weeks for it to come back, and it has not returned. Mm-hmm. And so
4 weeks, 4 or 5 weeks, 6 weeks, I think now, by now, about 6 weeks.
Yeah.
None. I mean, like, no arrhythmias.
Yes.
And no tachycardia, so, yes.
Wonderful stuff.
Yes. Yeah, it is.
Yeah, it's so exciting. So we just want to share, and we're going to teach you guys more about the Wellness Way approach. And it's please like and share this video because a lot of times we may be missing the root cause to the problem. And so that's what we're all about. So thanks for liking and sharing this video, and thanks so much, Teresa, for having an amazing gut intuition.
Yeah, thank you. Thanks for letting me share.